everyone, this is Yamini, currently pursuing my third year BDS degree. Speech upon a types of the tooth resorption and its management. Tooth resorption is a pathological or a physiological process that results in the loss of the dentin, cementum or a bone due to the action of the classitic cells. It can affect either the crown or a root of the tooth and may occur internally or externally. Tooth resorption is broadly classified into two: physiological resorption and pathological resorption. Physiological resorption. Physiological resorption is a normal process seen in a primary tooth. It helps in the exfoliation of the deciduous teeth to allow the eruption of the permanent teeth. This process is regulated and does not require any treatment. Pathological resorption. Pathological resorption occurs in a permanent teeth and is always abnormal. It is classified into internal resorption and external resorption. In internal resorption, it begins with a pulp chamber or a root canal and progress outward. It is of two types: internal inflammatory resorption and internal replacement resorption. And causes for it is a chronic pulp inflammation, trauma, and deep caries. And the clinical features are usually asymptomatic. In crown involvement, it may show a pinkish discoloration called as pink tooth memory. Graphic appearance. A well-defined symmetrical radiolucent enlargement of pulp space is seen. Management: immediate root canal treatment to remove the inflamed pulp tissues and stop the resorption. If a perforation occurs, a material like MTA are used to repair. And now let's see about the external resorption. External resorption starts from the outer surface of the tooth, divided into four categories like external surface resorption, external inflammatory resorption, external replacement resorption, and cervical resorption. External surface resorption, it's a self-limiting, usually due to the minor trauma. No treatment is required. And external inflammatory resorption occur due to the trauma, infection, or pressure associated with necrotic pulp. Management: root canal treatment and intercanal calcium hydrogen peroxide to arrest the process. External replacement resorption, ankylosis. A tooth structure is replaced by the bone, common after a severe trauma or reimplantation. Management: no effective treatment. In young patients, a decoronation may be done to preserve the alveolar bone height. Cervical resorption occurs at the cervical region of the tooth, often asymptomatic. Management for it is early detection is important, surgical exposure, and restoration of the GIC or a composite. If extensive extraction may be required. Diagnosis: it is mainly based on clinical examination, radiographs such as IOPA, CBCT in complex cases. Early diagnosis is crucial to prevent tooth loss. And here I conclude that a tooth resorption can be physiological or a pathological. Internal and external resorption have a different causes, clinical features, and the management protocols. And early detection and appropriate endodontic or surgical intervention plays an important key role in saving your tooth. And thank you.